Recording in progress.
Hi, good afternoon. I'm Dr. Sahari. I'm working as a consultant nephrologist at Care Hospital, Banjara Hills, Hyderabad. Today, I would like to discuss about chronic kidney diseases. Actually, in my last 5 years of experience, I have come across the fact that prevalence of chronic kidney disease is increasing in the world, but the awareness of chronic kidney disease is not as much as cardiovascular disease today. Is not as much as is not as much as cardiovascular diseases these days. Just to find out, the kidney elements are of two types, that is acute kidney injury or chronic kidney disease. Acute kidney injury is of it can be caused by many causes, sepsis being the most common cause. Most important thing to note is that kidney is the easiest organ to get affected in the body. It can be secondary to any other illnesses such as infections or otherwise any cardiac diseases which leads to cardiorenal syndrome, or liver diseases, that is hepatorenal syndrome, or secondary to pulmonary diseases, that is pulmonary renal syndromes. These all constitutes acute kidney injury. And second thing is coming to main burden of our community among the kidney diseases is chronic kidney disease. First, to note that chronic kidney disease increases along with the age, and it is a slowly progressive disease. And the main thing to note is creatinine, almost the creatinine, which is the marker of kidney function, doubles when the kidney function is almost lost by 50%. So one must be aware that simple rise in creatinine is an important fact to note that, and immediate intervention should be given. And coming to the common causes of kidney diseases, diabetes, which is the leading cause of kidney diseases. And coming to diabetes can affect any part of the body, such as if it affects the eye, it is called as retinopathy. If it attacks the neurons, it is called as neuropathy. If it attacks the kidney, it is called as nephropathy. And if it attacks the heart, it is called as diabetic cardiomyopathy. Second leading cause is hypertension. Hypertension and kidney disease is like a chicken and as well as egg type. Hypertension leads to chronic kidney disease, and hypertension can also be a consequence of chronic kidney disease. So hypertension must be addressed aggressively. Third is obesity, and fourth is if there is any chronic kidney disease in your family. These all five constituents constitute the major components of chronic kidney diseases, and immediate and early intervention leads to delay the progression of chronic kidney disease and halt the progression of chronic kidney disease. Chronic kidney disease, I want to elicit just 3 basic investigations and 5 basic rules, which are the golden rules of chronic kidney disease to prevent the progression of chronic kidney disease. First 3 basic investigations. What are the symptoms of chronic kidney disease? First of all, there may be periorbital swelling, that is, or otherwise generalized swelling in the body, or if there is any frothy urine, that is, if you are unable to flush the urine adequately, if there are bubbles in the urine, or if there is any pedal edema, that is leg swelling. These three are the main common symptoms of the chronic kidney disease, and it can affect any part of the body, ranging from mild symptoms to severe symptoms such as encephalopathy, seizures, coma, and as well as death. So CKD should be aggressively treated. And coming after the components of most common causes of chronic kidney diseases, I want to elicit that CKD is of 5 stages, stage 1 to stage 5. And stage 5 is nothing but 5D, which is called dialysis dependent stage, 5D stage, or ESRD stage, or ESKD, that is end stage renal disease, which elicits that means the patient becomes dialysis dependent. And the most common modalities of ESRDs, one is hemodialysis, peritoneal dialysis, and the main important treatment constitutes the transplant, which awareness of which is being increased nowadays. And 5 basic golden rules which helps in preventing the progression of chronic kidney diseases are: first thing, tight glycemic control, that is diabetes. If you are not a diabetic, at least yearly one screening of diabetes should be done. And if you are a diabetic, HbA1c screening should be done every 3 months, and tight control of diabetes should be done, because aggressive control of diabetes and tight control of diabetes helps in preventing the chronic kidney diseases. Second thing is, you should avoid foods such as junk foods and as well as cool drinks or any other artificial beverages, because it leads to increase in uric acid, which uric acid leads to uric acid nephropathy and leading to chronic kidney diseases. Third main point is, we should avoid self medications for pain, such as NSAIDs like diclofenac. All these should be avoided, because NSAIDs leads to acute interstitial nephritis, chronic interstitial nephritis, and CKD. Therefore, NSAIDs should be self medication should be avoided. And any medication which is being taken through mouth is usually any drug either through IV or through mouth. The basic point to remember is it can be metabolized either through hepatic or through the renal. So CKD patients who are taking any medications should consult a nephrologist for regular monitoring, and the dosage will be adjusted as per the creatinine clearance formula, which will be done by the nephrologist. Third one is, hello. And the third golden rule is we should hypertension should be addressed aggressively, and tight control of hypertension preventing the complications of progression of kidney diseases, because hypertension leads to hypertensive nephrosclerosis, benign malignant hypertension. So hypertension should be controlled aggressively. Fourth point is, and coming to this, just three simple investigations which helps of this. And another most important golden rule is, any chronic kidney disease, if he is suffering from any type of illness, kidney is the organ which is going to be easily affected. Therefore, a regular monitoring of creatinine regular monitoring of renal parameters like creatinine, urea should be done. And coming to three basic tests which helps in detecting kidney disease is just simple physical tests such as blood pressure monitoring. If there is any increase in the blood pressure, one should be concerned of the fact that it may be mostly due to renal cause, second cause may be the cardiac cause, and third may be minor causes such as endocrine causes. So if there is a simple blood pressure monitoring, and second thing is simple blood test which will tell us the elevated renal parameters such as creatinine and urea. Creatinine above 1 warrants necessary investigations, and necessary investigations should be done to find out the cause. And third one, CUE, complete urine analysis. Simple urine analysis can tell us whether there are any gas or whether there any protein is lost whether there is any protein being lost in the urine, because kidney has a functional unit called as glomerulus. Glomerular filters the protein. Any damage to the glomerulus leads to loss of protein, and loss of protein in the urine. So simple basic tests. So the 5 golden rules and 3 simple basic tests such as BP monitoring and CUE and as well as simple blood tests can help us preventing the chronic kidney diseases. Chronic kidney disease, if detected early, can be prevented, and it can be prevented. Second thing is, if there is any chronic kidney disease in the family or any elements in the family, you should consult a nearest nephrologist and get the proper test done. Thank you.